Poor circulation, memory loss, even heart failure, all of them can start with something as simple as a dry mouth when you wake up. Most people reach for a glass of water and move on with their day. But what if that dryness isn't thirst? What if it's your body sending you a warning signal you've been ignoring for years? Here's what shocks me most. Chronic morning dry mouth affects nearly 1 in 3 adults over the age of 60. And in the vast majority of cases, it has nothing to do with not drinking enough water the night before. Nothing. And yet almost nobody is talking about this. Not your pharmacist, not even your regular doctor at your annual checkup. Stay with me until the end, because the number one cause I'm going to reveal today sits quietly inside your medicine cabinet or on your nightstand, and it may be doing far more damage than just drying out your mouth. We're talking about something that could be silently affecting your kidneys, your heart, and your brain at the same time. I'm Dr. Markus, a physician specialized in senior health with over 15 years of dedicated clinical experience. I've sat across from thousands of men and women over 60 who came in complaining about something that seemed minor, only to discover a serious underlying condition hiding in plain sight. Morning dry mouth is one of those symptoms, deceptively simple on the surface, potentially life-changing underneath. If this information seems valuable to you, hit that like button right now. It helps this message reach the people who truly need it. Let's start with what's actually happening inside your body. Your mouth depends on a constant supply of saliva. And saliva is not just water. It is a complex biological fluid packed with enzymes, antimicrobial proteins, and minerals that protect your teeth, your gums, your throat, your digestion, and your immune system. After 60, your body produces roughly 30 to 40% less saliva than it did in your 40s. That alone creates vulnerability. But that baseline reduction becomes dangerous when it combines with the 7 causes I'm about to reveal. Here's what terrifies me most. Chronic dry mouth is associated with a 45% higher risk of systemic infections in adults over 60, according to research published in the Journal of the American Geriatric Society. Why? Because saliva is your body's first line of immune defense. Strip it away, and bacteria, fungi, and viruses have an open door straight into your bloodstream. So let's go through all 7, from the least dangerous to the one that concerns me most. Before we dive in, how long have you been waking up with a dry mouth? A few weeks? A few months? Maybe years? Type your answer in the comments. I read every single one. Sup? Sleeping with your mouth open. This is the most common and most overlooked cause of morning dry mouth in adults over 60. And before you think this one is obvious and harmless, hear me out, because mouth breathing during sleep is rarely just a habit. It is almost always a symptom of something else. When you breathe through your mouth at night, airflow passes directly over your tongue, your palate, and the back of your throat. That airflow evaporates moisture at a rate your salivary glands simply cannot keep up with while you sleep. The result is a mouth that feels like sandpaper when you wake up, cracked lips, a thick coated tongue, and sometimes a sore throat that has nothing to do with a cold. Here's the deeper issue. Mouth breathing is frequently caused by nasal congestion, a deviated septum, nasal polyps, or sleep apnea. And sleep apnea affects nearly 22% of adults over 65. Left untreated, it is linked to a 60% increased risk of stroke and a 40% increased risk of heart failure. So if you wake up with a dry mouth, snore heavily, feel exhausted despite sleeping 8 hours, or your partner says you stop breathing during the night, please talk to your doctor about a sleep study. Practical fixes. Nasal strips worn across the bridge of your nose can increase nasal airflow by up to 38%. A humidifier set between 40 and 50% humidity reduces overnight moisture loss dramatically, and sleeping on your side significantly reduces mouth breathing. Pro tip: a small piece of surgical tape placed vertically over the lips before sleep sounds unusual, but sleep specialists have used this technique for years. Safe, inexpensive, and many patients notice a difference within the first week. 6. Dehydration that starts in the afternoon. Most people assume they simply need to drink more water before bed, so they gulp down a large glass right before sleeping, and it doesn't fix the problem. Here's why. Your body does not hydrate in real time. When you drink water, it takes between 30 minutes and 2 hours to be absorbed and distributed to tissues. Drinking water at 10 at night does almost nothing for your mouth at 6 in the morning. The real issue is afternoon dehydration. Research published in the European Journal of Nutrition found that adults over 60 who did not consume adequate fluids between noon and 4 in the afternoon were 62% more likely to report significant overnight dry mouth symptoms. After 60, your thirst mechanism becomes less reliable, your kidneys become less efficient at conserving water, and many older adults unconsciously reduce fluid intake in the afternoon to avoid nighttime bathroom trips, creating a chronic low-grade dehydration that peaks overnight, precisely when you have no opportunity to correct it. The fix: front-load your hydration earlier in the day. Aim for 6 to 8 ounces of water with every meal and every snack. And if you're concerned about nighttime urination, know that proper daytime hydration actually reduces nighttime trips for many people, because the kidneys concentrate urine more efficiently when the body isn't running in a chronic deficit. Pro tip: add a small pinch of sea salt and a squeeze of lemon to your afternoon water. This supports electrolyte balance, helping your cells actually retain fluid instead of letting it pass through quickly. Vitamin deficiencies targeting your salivary glands. Your salivary glands are not just passive plumbing. They are metabolically active tissues that require specific nutrients to function. And 2 deficiencies destroy salivary gland function in adults over 60 faster than almost anything else. The first is vitamin A, essential for the health of all mucous membranes in the body, including those lining your mouth, throat, and digestive tract. When vitamin A drops, these membranes become thinner, drier, and less functional. A study in the journal Nutrients found that adults over 60 with low vitamin A had a 41% reduction in resting saliva production. The second is B vitamins, specifically B3 and B12. B3 deficiency impairs the nerve signals that trigger saliva production. B12 deficiency causes the tongue to become inflamed, smooth, and abnormally dry. Together, these create a dry mouth that no amount of water can fully correct, because the problem is not hydration, it's cellular function. After 60, your ability to absorb B12 from food drops significantly due to reduced stomach acid. Up to 30% of adults over 60 have inadequate B12 levels and have no idea. Food sources: vitamin A, sweet potatoes, carrots, dark leafy greens, eggs, B12, lean meats, fish, dairy. For many adults over 60, supplementation is also necessary. A B complex with at least 1,000 micrograms of methylcobalamin B12 is a good starting point, along with vitamin A at no more than 5,000 IU daily. Always speak with your doctor first. Pro tip: vitamin A is fat-soluble. It absorbs best with a small amount of healthy fat. Add olive oil or avocado to your vitamin A-rich meals for dramatically better absorption. Blood sugar imbalances overnight. If you wake up with a dry mouth and you also wake up to urinate more than once during the night, this combination is a warning flag I take extremely seriously, because together, these 2 symptoms are among the earliest signs of uncontrolled blood sugar and, in some cases, undiagnosed type 2 diabetes. Here's what happens. When blood sugar rises above a certain threshold, the kidneys go into overdrive filtering excess glucose, pulling water from the body's tissues in the process. That fluid loss dehydrates you from the inside, and one of the first places you feel it is your mouth. A 2021 study in the journal Diabetes Care found that morning dry mouth was reported by 63% of adults newly diagnosed with type 2 diabetes, and that many had experienced this symptom for over a year before their diagnosis. I had a patient, a 71-year-old retired teacher. She mentioned her dry mouth almost as an aside, assuming her bedroom was just dry. I asked a few questions. Getting up twice at night? Yes. Afternoon fatigue? Yes. Occasional blurry vision? Yes. She thought she needed new glasses. I ordered a fasting blood glucose panel. Her levels came back at 148. She had type 2 diabetes and had been living with it unknowingly for nearly 18 months. With dietary changes, a daily 30-minute walk, and targeted supplementation, she normalized her fasting glucose within 4 months. She told me, "Doctor, I sleep through the night now. My mouth feels completely normal." That wasn't luck. That was information acting as medicine. A simple fasting blood glucose test at your next routine visit can answer this question definitively. If your fasting glucose comes back above 100, your doctor will want to monitor it. Above 125, a diabetes diagnosis is on the table. This is not a reason to panic. It is a reason to be informed. 3. Autoimmune conditions affecting your glands. This one has been known by the medical community for decades, and yet it remains profoundly underdiagnosed in adults over 60. The condition is called Sjogren's syndrome. It is an autoimmune disorder where the immune system mistakenly attacks its own moisture-producing glands, primarily the salivary and tear glands. The result is severe dry mouth, chronic dry eyes, difficulty swallowing, and in more advanced cases, joint pain, fatigue, and even kidney or lung involvement. Approximately 4 million Americans currently live with Sjogren's. Women over 60 represent nearly 90% of diagnosed cases, and the average patient waits nearly 3 years from first symptoms to diagnosis because dry mouth gets dismissed, dry eyes get blamed on screen time, and joint pain gets attributed to arthritis. Each symptom treated in isolation while the underlying autoimmune process continues unchecked. The key diagnostic clue: if your dry mouth is accompanied by persistently dry, gritty, or burning eyes, and you are a woman over 60, ask your doctor specifically about Sjogren's syndrome. A blood test measuring anti-SSA and anti-SSB antibodies can identify the condition. While there is no cure, there are effective treatments, including prescription medications to stimulate saliva production and immune-modulating drugs that slow progression significantly. Pro tip: sugar-free gum containing xylitol is one of the most effective tools for stimulating saliva without a prescription. Studies also show xylitol inhibits the bacteria that cause tooth decay, critical because dry mouth dramatically increases cavity risk. 2. Neurological changes and early cognitive decline. This is not something most people associate with a dry mouth, but the connection is both real and significant, and every adult over 60 deserves to know about it. Your salivary glands are controlled by the autonomic nervous system, specifically the parasympathetic branch. When that system becomes compromised, salivary activity drops and the mouth dries out. Research shows that autonomic nervous system dysfunction is an early feature of progressive neurological conditions, including Parkinson's disease and Lewy body dementia. And in a counterintuitive twist, while advanced Parkinson's is associated with drooling, the early stages can actually produce dry mouth, particularly at night. A study in the journal Movement Disorders found that autonomic symptoms, including altered salivary function, appeared an average of 4 to 6 years before classical Parkinson's motor symptoms were diagnosed. I want to be clear, dry mouth alone does not mean neurological disease, but dry mouth combined with a reduced sense of smell, unexplained constipation, vivid or disturbing dreams, a slight tremor in one hand, or lightheadedness when standing. That combination warrants a conversation with a neurologist. I had a 78-year-old patient who had mentioned dry mouth for about 2 years. We addressed the obvious causes. Nothing fully resolved it. Then his wife mentioned he had stopped recognizing the smell of his morning coffee. A dopamine transporter scan confirmed early Parkinson's disease. Because we caught it early, he began neuroprotective therapies before significant motor symptoms developed. His quality of life 3 years later remains high. He told me, "I almost didn't mention the dry mouth. I thought it was trivial." No symptom is trivial. Your body is always speaking. We just have to learn to listen. This is the cause I encounter most frequently, and it is the one most consistently overlooked, most underreported, and most poorly communicated to patients. Over 500 commonly prescribed medications list dry mouth as a side effect, and for adults over 60 who take an average of 5 or more medications daily, the cumulative effect on salivary function can be profound. The most common offenders include antihistamines, including diphenhydramine found in Benadryl and most over-the-counter sleep aids, antidepressants, particularly older tricyclics, and certain SSRIs, blood pressure medications including diuretics, alpha blockers, and beta blockers, bladder medications for overactive bladder, antipsychotics, Parkinson's medications, and certain pain medications and muscle relaxants. Here's what makes this truly dangerous. Most people assume that if dry mouth is listed as a side effect, it must be minor and unavoidable. It is not. A 2020 study in the Journal of the American Medical Association found that adults with chronic dry mouth have a 73% higher rate of tooth decay, a 68% higher rate of gum disease, and a significantly elevated risk of oral fungal infections that can spread into the throat and esophagus. Beyond the mouth, severe medication-induced dry mouth is a marker of anticholinergic burden. That's the cumulative neurological impact of multiple medications that block a key neurotransmitter called acetylcholine. High anticholinergic burden has been linked in multiple large studies to an elevated long-term risk of dementia. I had a 74-year-old patient, blood pressure medication, a nightly sleep aid, an antihistamine, and a bladder medication. 4 prescribers. Not one had reviewed his full medication list together. We brought in his pharmacist for a reconciliation review, switched 2 medications to safer alternatives, and eliminated the antihistamine in favor of a nasal steroid spray. Within 2 months, he told me, "My mouth feels like my mouth again, and my afternoon brain fog, which I thought was just aging, has nearly disappeared." That was not a coincidence. Here's what I want you to do. Write down every medication you take, prescription and over-the-counter. Bring that list to your next appointment and ask specifically, do any of these contribute to dry mouth? Is there an alternative with less impact on saliva production? That single conversation could change your quality of life significantly. Here are 5 changes you can begin immediately. 1. Stop taking any over-the-counter sleep aid containing diphenhydramine, found in Zaquil, Unisom, and most generic sleep aids. It is one of the most potent salivary suppressants available without a prescription. Melatonin at 0.5 to 1 milligram is a far gentler alternative. 2. Run a humidifier in your bedroom tonight. Set it between 40 and 50% humidity. Many people notice a difference by morning. 3. Front-load your hydration. 6 to 8 ounces of fluid with every meal and snack. Taper off after 7 in the evening. 4. Brush with a fluoride toothpaste formulated for dry mouth before bed. These contain extra moisturizing agents that protect your oral tissues overnight. 5. Eliminate mouth breathing. Try a nasal strip tonight. Sleep on your side. If you snore heavily or stop breathing during sleep, schedule a sleep study. Do not delay. Within 1 week, most people notice meaningful improvement. Within 2 weeks, many report the cottonmouth feeling they had accepted as normal is largely gone. Do not drink large amounts of water right before bed. It won't fix your morning dryness and may increase nighttime bathroom trips. Do not ignore dry mouth if it comes with dry eyes, joint pain, or unexplained fatigue. That combination needs medical evaluation. Do not assume your medications are fine simply because they were prescribed. A medication review is a legitimate medical service. You are entitled to ask for it. Let me recap the 7 causes. Mouth breathing during sleep, afternoon dehydration, vitamin A and B deficiencies, blood sugar imbalances, Sjogren's syndrome, early neurological changes. And the most common cause by far, the cumulative effect of medications suppressing saliva, sometimes creating an anticholinergic burden with consequences far beyond your mouth. My message today is not alarm, it is empowerment. You now have information that most people over 60 have never received. This week, write down every medication you take and bring it to your doctor. Run a humidifier tonight. Front-load your hydration starting tomorrow. And if you have dry eyes along with your dry mouth, book an appointment and ask specifically about Sjogren's syndrome and your anticholinergic medication burden. Your health is worth that effort. Your independence is worth that effort. And the people who love you are worth it too. If this video helped you, smash that like button, subscribe to Healthy Seniors Corner, and share this with someone you care about. You may give them the piece of information that changes everything. Which of these 7 causes surprised you most? Tell me in the comments. I truly want to know your story. Because remember, aging does not take away your body's ability to recover. It simply reminds you to care for it the right way. This video contains general medical information based on published research and clinical experience. It is not a substitute for personal medical care. Never change or stop your medications without consulting your physician. Always speak with your healthcare provider before modifying your supplement routine, especially if you are on prescription medications.